Good morning. It's my pleasure to be here this morning and just briefly share a couple of examples in virtual platforms for outpatient care that we have launched in our community. By way of a little background, Winona Health is located in southeast Minnesota, right on the Mississippi River. We're an independent, community-owned healthcare system. We have a hospital, 49 beds. We provide primary care and some specialty services, as well as post-acute care. This last year, we just finished 125 years of serving our community. And so what I will be talking about here is just our future state of how our organization has innovated, changed, evolved over 125 years, and we continue to do so today. So our care transformation goals today, when we think about the situations that we're facing, many of them talked about earlier, are to reduce the cost to patients, increase access, and collaborate with key partners. So my comments in these examples are really patient-focused in how we can change the paradigm for their experience in healthcare. The first platform is called the Smart Exam. So this is a virtual platform where a patient can access care through a smart device. Could be a smartphone, an iPad, a computer, and they can do it from anywhere. Home, work, a park, a conference perhaps. So it's not tied to a particular location. This system is integrated within our EMR, so there's some information flow that happens, and it's our providers who are providing the care to people who access the Smart Exam. So you can see on the screen a number of the modules that are available for people for care. This is designed for lower acuity primary care. There are over 400 diagnosis codes that are covered within these modules. From a patient perspective, the patient will access the Smart Exam through the portal on our website, and then they pick whichever one of the modules, for example, suits their symptoms that they're experiencing, and then the system will walk them through an interview process, if you will, collecting data. The questions are, fairly straightforward, easy to comprehend. There's diagrams that a patient can look at. It'll direct them how to do some different types of things. The patient could even take a picture. If it's a skin rash, they could take a picture and upload that picture and put that into the Smart Exam as well. If they type something in and it's misspelled, the system will give them some prompts in terms of accuracy to make sure it has accurate information. They'll complete their exam, and at the end, they'll be asked, do you have a preferred pharmacy in the event that there's prescriptions that are needed? So they'll pick their pharmacy, and then they'll pay for their exam online. So we'll do a credit card, debit card, HSA card, and this is a $39 visit. We don't do insurance on this. That's an option, but we aren't doing this. We're trying to keep the price point very low for patients. The exam will complete. They'll be told that your exam has been sent to a provider, and they'll be back with you shortly. From the provider perspective, our physicians use their smart devices as well, and they're either on service or off service, so it's an easy turn on, turn off. As soon as an exam comes in, they're pinged, and so they can see there's a visit waiting and there's a short summary. They can open up the exam, and all of the data that was input by the patient is summarized for them in a note. They can go back and look at any of the questions or information if they want, but there's a nice summary, a recommended diagnosis, and a treatment plan. In their review of all of that, they can make any changes. They can change the diagnosis or the treatment plan. They'll finish the full summary. They'll sign off, send prescriptions to their preferred pharmacy if needed, and close out that visit. The patient will get emailed their pharmacy information. The scripts were sent. They'll have also a summary of their exam sent to them. And then that exam goes into our EMR. There are some times that this is not an appropriate venue. Somebody may have needs that are beyond the scope of this platform. So the system or the provider can convert that visit, which means that it'll say you really need to go in and see a provider. Our providers will often just call the patient and say, please come in, I'd just like to see you. If that happens, then there is no charge for the exam. We've launched this back last spring, did some work internally with our staff and then out into the community, so I've been tracking the data on all of this. Some of the findings that we've had is that the most popular times and days are weekdays from 8 a.m. to 12 noon that people are accessing the Smart Exam. We can track how much time it takes for patients to complete the exam. We can track how much time it takes providers to complete the exams. We've been tracking how many visits we have per month. Certainly we saw a big uptick this last fall with the flu season, which is a common use for all of this. And then most importantly, our patient satisfaction, and patients really like this exam. Here's some of the other just sort of numbers. You can see some of the times that are in there. Colds, cough, sinus, allergies, and so forth are the primary reason people use this tool. Women's health is a close second. I mentioned converted visits. 64% of our visits are completed and the others are converted. And then you can see the demographics. We thought maybe college students would really like this. As it turns out, it's pretty well distributed across a lot of age cohorts. And primarily women are the ones that are using this exam. So we found this to be a valuable and effective way that patients really like to receive care. The second platform is our e-cardiology and internal medicine. This is a collaborative partnership that we have with Avera eCare out of Sioux Falls. We just launched this in December, so this is very new for us. This is where patients come on site and have a virtual visit with a provider. As I mentioned, we do this with cardiology and general internal medicine. And the virtual physicians are members of our medical staff. The CART, our staff named Sheldon, if you're familiar with Big Bang Theory. That was a nice icebreaker for patients who really like that. And then Kayla is the person who facilitates the visit to make sure it goes really well. Just in 4 weeks of data here, our target was really about filling those visits and having the experience and seeing how all of this works. So we've been really pleased with that. Patients are very receptive. They're very gracious if there's any little bugs in the technology or things that we need to work on, and have really been pleased with the service that they've gotten. And then our providers, just communicating the virtual providers to our on-campus providers has been really a great experience as well. Thank you.